There was one time we actually looked at a disease condition known as what hepatic encephalopathy, where we are saying problems from the liver led to some complications in the brain. Okay, so now we are looking at the hepatorenal syndrome. Hepatorenal syndrome, you could see hepato, that's hepatic, that's liver, right? You could see renal, that's what something having to do with the urinary system. So in hepatorenal syndrome, we are trying to say what? A problem in the liver is leading to some complications in the kidney. So let's see how we can be able to what? Relate the two organs in this. So hepatorenal syndrome is what? A rare syndrome characterized by renal failure due to some liver problems, right? So let's look at it in depth, from the definition to the types to the causes, the symptoms, and the rest. Hepatorenal syndrome is a type of kidney dysfunction that occurs in patients that have advanced liver disease. Okay, so I'd like you to just say advanced liver disease rather than saying liver cirrhosis. So say advanced liver disease, for example, liver cirrhosis. Okay, definition. This is characterized by what? There's a rapid progression of what? Kidney dysfunction. There's significant reduction in kidney function, right? So you see that those kind of patients, they will not be making urine like they are supposed to be making. All right, there's absence of other causes of kidney disease except that liver problem. Okay, so what are the types? You could have the type 1 where you're having a rapid progression and you're having more than 50% of the kidney function is decreased within just 2 weeks. You could have in the type 2 where there's a gradual progression, which is taking between 2 to 4 weeks, right? What are the causes? Liver cirrhosis is number 1, but you could have other things like what? Portal hypertension, splanchnic vasodilation, renal vasoconstriction, and decreased renal blood flow. Okay, what are the risk factors? If the patient, like, what are the things that predispose a patient to having this problem? If the patient already have an advanced liver disease, okay, if there's ascites, there's spontaneous bacterial peritonitis, if there's hepatic encephalopathy, if there's portal vein thrombosis, okay. Symptoms, there will be oliguria, that's what? There's some complications in the kidney, so the the urine making is low. There's anuria, there could be absence, total absence of what? Urine production. There could be azotemia, where there's elevated blood urea nitrogen. There could be hyperkalemia, where there's elevated potassium levels, right? Then there could be metabolic acidosis, okay? Diagnosis, you do what? Serum creatinine, and you see that it is more than 1.5 milligrams per dl. If you test for blood urea nitrogen, you see that it is more than what? 25 milligrams per dl. If you check for sodium, it will be less. And there will be absence of other causes of kidney disease, right? The only thing that you could actually point at is actually the liver disease, okay? Then treatment. You could use drugs like what? Midodrine and octreotide, albumin infusions, transjugular intrahepatic photosystemic shunts can also work. Liver transplant, hemodialysis can also work, okay? Then complications. This could lead to what? Total kidney failure, total liver failure, septic shock, and multi-organ damage, right? Then ultimate death of the patient. Okay, so that's it for this hepatorenal syndrome. See you guys.